Perspective on Florida Gateway College Television is sponsored by Potash Corp of White Springs. Potash Corp, helping nature provide.
Hello everyone and welcome to Perspective. This is a public affairs presentation of Florida Gateway College. My name is Mike McKee and my guest on the program today is Melinda Sganga. She is a physical therapist with a brand new facility called Fyzical. And the topic today we're going to talk about is balance and how as you get older, sometimes you lose it. And we'll talk about that and what you can do to avoid a fall when we come back. Don't go away.
Day starts before your feet touch the floor. You listen and encourage, plan and schedule, and work hard for the ones you love. You inspire creativity, help with homework, and somehow still find time to do your own. You are an example every day, investing in her future and yours. Florida Gateway College. Start here, go anywhere.
Welcome back to Perspective here on Florida Gateway College Television. Melinda Sganga is a physical therapist at Fyzical Physical Therapy. Welcome to the program.
Thank you for having me.
Now you and I talked, and your husband, I've known Brian for years, and we were talking about the new, well, it's nothing new, but as people age, they lose balance. And so let's talk about, your practice is kind of geared toward helping those who have lost it. Tell us the cause of people falling and talk about that. Is it age or can anybody fall?
Sure, anyone can fall. The thing is that most people think that as we age, losing balance is a natural phenomenon, and it isn't. There's usually an underlying cause. It's not age related per se, but some of the things that go along as we age tend to cause people to lose their balance. When we look at a patient that comes in and they say they're having balance issues, they may have an inner ear problem, they may have visual problems, they may have had a knee replacement or a hip replacement, or they may have had a stroke. There are lots of things that tend to cause people to lose their balance.
Now, when they come to see you, are they coming because they have the balance problem, or is a doctor seen them and said, you know what, let's check out the inner ear, or let's do some exercise? Talk
Right.
about what you're working very closely with a doctor, normally a primary care physician, correct?
Correct. Well, we get a lot of patients that come in for different reasons and through different avenues. Sometimes it is from their family physician, and they've gone in and they've complained of having some balance issues and want to do something about it, and their doctor knows about us and refers them. Sometimes we get patients from neurologists. We've had patients come in from audiologists and neurologists and ear, nose, and throat doctors as well. We have a lot of patients that see our commercials or hear about us through friends that have come and been successful at improving their balance, and then they then go to their doctor and ask to be seen by us, and then they come that way as well.
Now you mentioned that knee or hip replacement can cause those issues. What do you do with a patient that has had maybe, and I know you probably see a lot of those patients that have to get, you just don't walk out of surgery and walk like you walked before.
Correct.
Talk about what you take people through so that they won't lose their balance or learn to walk again.
So there are three different systems that we use to help us maintain balance. One is your vision, and as I mentioned before, if a person has cataracts, we certainly will send them to an eye doctor first to see if that's something they may need to have removed, if they're ready for that. As well as the inner ear problems, we'll make sure that they have had their heart checked out. If we feel like they may have had some neurological symptoms, we'll make sure that their physician clears them with imaging to make sure they haven't had a stroke. But if they came in specifically after a hip replacement or a knee surgery, it doesn't necessarily have to be a replacement. You're right, people assume sometimes, well, once I get a new knee, then I'll be great and I can walk. What they don't realize is that you have receptors in your joints and throughout your body that tell you where you are in space. And so you have to retrain those as well. And so we do a lot of balance training with those patients, as well as patients that come in for what we consider vestibular problems.
Now, say I'm at the age and my knees just, I played sports and the orthopedic surgeon said, we got to replace your knee. All right, so I go through the surgery and I say, all right, Melinda, what am I going to be doing? Talk me through, if a patient may be apprehensive about even having the procedure done, and they usually say the surgery is not the bad thing, it's the rehab. Talk about, let patients know that it's not that bad.
Well, actually, it isn't. That isn't accurate. A lot of times people will come to me and they'll say, I think I need a knee replacement, but I'm really afraid of having a knee replacement. I've heard it's really awful. I've heard the therapy is really painful. And I don't know where they get that idea from. As far as our clinic, our first endeavor is to get people out of pain as quickly as possible. Therapy should not be painful, ever. There's a difference in soreness and pain. So if someone has a knee replacement, I always remind them that your doctor wouldn't recommend a knee replacement if you didn't need it. And prior to having a knee replacement, people's quality of life has usually deteriorated to the point that they're not enjoying life and they're in constant pain every day, and it progressively gets worse. Whereas if they have the knee replacement, they'll have surgical soreness, but the knee pain itself will dissipate, and over time they'll have less and less pain and get a better quality of life.
Okay, so take us through a therapy session. Say I come in, I've had the surgery, I'm on crutches,
Okay.
right?
Maybe.
You normally have crutches. And I come in, and so what are you going to do for me first? You're obviously going to evaluate where I am, right? So
right.
tell the people at home what they can expect.
Okay, so if you were to come in for an evaluation, we would spend an hour, we would talk about your history. If you had, as the example of a knee surgery or a knee replacement surgery, then we would go through the evaluation, find out what your baseline measurements are, and I would get from you the information of what is your goal, what is it you want to accomplish, what is it you need to get back to, and then see what's keeping you from doing that. And as I said, the first goal is to get you out of pain. Most of the time after surgery, there's a lot of swelling. If you can get the swelling under control quickly and the range of motion back, the rest becomes very easy after that. And then you basically go through the steps of strengthening, and then lastly, you'll focus on balance and normalizing a person's, the way they walk again, to look natural.
Now, is it recommended that right after surgery you start this? Or
Yes.
Tell the people why that is.
Again, getting the swelling under control is paramount, and most of the time when a person has surgery and there's swelling associated with it or pain associated with it or a loss of movement, you don't want to move it, and that will be detrimental to the overall progress after the surgery. You can have a fantastic surgeon do a great job, but if you don't do your therapy and you don't do it correctly, or you've been given the wrong therapy, you will not get the recovery that you anticipated. So it's very important to do exactly what your doctor tells you to do and start therapy as soon as possible after the surgery.
Okay, so we've talked about surgery, and let's talk about balance issues.
Okay.
Doctors recommended they come to see you because the doctor has a theory about what's wrong with you, and so you evaluate them. Take us through an evaluation of someone and how you can help them, maybe even right away.
Okay, great. So when a person comes in, I first evaluate how they walk in the door, how they get up from a chair, and it'll tell you a lot about some of the problems they're having. But when you look more specifically at what they're coming for, some patients will describe themselves as dizzy. Some will say, no, I just have this feeling around my eyes, or I just feel lightheaded if I turn quickly. And so they stop moving naturally because they're afraid of falling, or they don't like that sensation. So there's more than one type of dizzy patient or person that's imbalanced. And so when they come in, we ask a series of questions. Because I explain to everyone that your balance is based on three systems. Your visual systems, we want to make sure they've had their eyes checked. Your what we call your vestibular system, which is comprised of your inner ear and the semicircular canals, as well as the brain, the central vestibular component. And then the rest of your body is your somatosensory system, which would be more like the sensation in your feet to make sure you have proper strength in both of your legs and you have full range in your joints.
So you check all of those.
All of those.
And you do this through the evaluation. And then, okay, so you figure out it's maybe neuropathy.
Okay.
And so you may have, and for those, that's a byproduct of diabetes. It
can be.
Circulation not getting to the lower extremities, and that could cause the problem. So what type of exercises or what type of therapy do you do for someone that has that condition?
So if a person has peripheral neuropathy, whether it's due to diabetic neuropathy, some people develop it after having chemotherapy. You can develop neuropathy in your hands and feet. And so we have a treatment called anodyne, which number one, increases the peripheral circulation to those nerves to then have them properly function so that you get sensation back. We have patients that had no sensation in their feet, so obviously their balance will be off because they can't feel their feet, or they'll say things like, it feels like I'm walking on sponges. So we will improve their circulation, and then their sensation improves and it feels more natural, and then they have better balance. And that's the somatosensory component. Like I said, if there's a vestibular component, then we have to address that as well. Often the patients that we're seeing are coming in with a vestibular problem, whether it be vertigo. Unfortunately, a lot of times their first symptom is the room is spinning and they're very nauseated, even get sick, and they go to the emergency room a lot of times, and there they'll give them medication to try to get the symptoms to go away, but the underlying condition is still there, and unless that is addressed.
That's vertigo?
That's vertigo when the room is spinning.
What causes vertigo?
So what causes vertigo is the peripheral vestibular system, or the inner ear, and the semicircular canals have what we call detritus or debris. They're little otoconia, they're crystals, and they are supposed to be in there in place, but sometimes with age, with trauma, with viral infections, they can kind of break off or slough off, and as they do, they fall through the semicircular canal. And that canal is filled with kind of a thick liquid, kind of like hydraulic fluid. And there's not supposed to be anything in there moving, and as you move your head, it tells you where you are in space because the thick fluid stays there and your head moves around it, and it gives your vestibular system input to know where you are in space. However, when that debris gets in that canal, if you move your head like this and it starts floating down through that liquid, it will give your brain and your body the sensation that you are moving when you're actually staying still, which is very disorienting.
How do you fix that? Or do you fix that?
You can fix that, yes, absolutely. It depends on, we do different maneuvers, what they call canalith repositioning, depending on where the debris is, which canal. There are 3 canals in each ear, and they're mirror images of each other on each side of the head. And it depends on if it's in your anterior, posterior, or lateral canal. There's different maneuvers that you do, and they're not difficult to do, and they usually resolve the problem with 1 or 2 treatments.
All right, well, what we did is we wanted to see the good works that they're doing at Fyzical, and we took a camera crew down to see some patients and some therapies that you go through. And let's take a look. Let's roll that tape right now, take a look at it, and we'll let you see what goes on down there.
We're going to be demonstrating use of the Bertec balance system and how it can help our patients transition from non-weight bearing to partial and full weight bearing, as well as improve their balance and their limits of stability to reduce the risk for falls. This screen is going to encourage the patient to weight shift into the circle, and this helps them improve their directional control, their reaction time, and their balance.
Well, you're getting in a car running down the highway. Yeah, leaning forward, you're falling back. Yeah.
So Brian is having this patient demonstrate eyes closed while standing on foam and different head positions in order to challenge his vestibular system and decrease his risk for falls.
4, 5. Tilt your ear to shoulder, left side.
Left, wait a minute now.
Tilt.
Say that again.
Tilt your head to your shoulder.
Okay.
2. Now it's close. No, straight ahead.
Oh.
Close your eyes. Now down. 2, 3, 4, 5.
And with this eye chart, we do gaze stabilization exercises. We don't actually use the eye chart to test a patient's vision, but what we can use it for is to maintain focus and clarity while they perform stabilization exercises with head turns. This is something that's a very common problem in patients that come in complaining of imbalance or fogginess or wooziness feeling in their head, and a lot of times it has to do with the fact that their visual system and their vestibular system does not match up properly. So here, practicing gaze stabilization exercises, it's important that you do them at the proper frequency or rate in order to keep the patient's eyes focused on their target. So we use a metronome, and sometimes we start someone at 60 beats per minute and we gradually increase that until they get up to 120 beats per minute.
We have a
like that. And once a patient has progressed through a lot of their balance activities, we can actually start doing very high level dynamic balance activities with compliant surfaces, with different head positions, eyes open, eyes closed, and even turning 360 degrees. And we also practice stair climbing and curbs to help our patients know that they can safely ambulate in their home and when they're out in the community. And we have them in a harness system during that as well to make sure they're safe as they do this.
That's really interesting, for those who have never been to a physical therapist. And, again, there's all kinds of, people talk and they say, well, I had a bad experience doing this, or I had a bad experience. And so rumors become fact, and so it's good to see what exactly is being done at your facility. Would you call yourself cutting edge in technology, or just, because, you don't hear many physical therapy organizations that do balance stuff?
Right, and actually we are positioned to be experts in this field. There's not a lot of other people that take the time and have the equipment that we have to treat this population of patients. And if you ask me if we're cutting edge, I would have to say yes. The technology that we have here in our practice doesn't exist anywhere else in North Central Florida. With our track system, the harness system, the BirdTech balance system, the training that we've had, no one else in this area is doing what we're doing.
Does it make people have a feeling of well-being when they know that they're not going to fall, or if
It's interesting because the first time they come in, when we try to explain to them, well, we're going to have you do these types of things, they're very anxious because they say, well, I know I can't do that, I'll fall. And that's why we installed the track system with the harness, so that we know we can push them to do dynamic things that otherwise they wouldn't be able to do. And then they do realize that they can be successful doing them. And it's fantastic, the outcome. Patients, for the first time, start walking more naturally. They're not afraid to go up and down steps. They're not afraid to walk on sand. And we challenge them with all those types of things.
So do most patients kind of feel like this is the way it's going to be, and so they don't want to accept the fact that they could get help?
Yes, unfortunately, by the time some of them have come to see us, they have been through anywhere from 3 to 8 physicians. And if I can share a story, we have one particular patient in mind that comes to mind. She had an acoustic neuroma, which is a tumor, and it went undetected to the point that it knocked out the vestibular function on the right side completely, and she won't get that back. And when I first met her, she came in with a rolling walker. And even though she had a rolling walker, because half of her vestibular system wasn't working, she had to constantly move her head to get input of where she was in space. And she came in and she shared her story with me and told me that they told her that she would have to learn to live with that. I am happy to say that after treating her, she does not have a rolling walker. She has no deficits. And she said, I think on her second week of treatment, she started crying, and I said, is everything okay? And she said, this is the first time in 2 years and 9 months that I have had hope. So yes, it can be life-changing.
So what you're telling me is that if patients want to see what you got down there, you welcome, and I know Brian probably could give tours to people. If
sure,
they want to
we
see
do it all the time.
What you have. Mm-hmm. Again, there's doubting Thomases everywhere, and so if you're doubtful that there is help for you out there, just
come in and see us, talk to us. We'd love to give you a tour, show you what we're doing.
Mm-hmm. And I think you think they'll be impressed with what you're doing.
I think, again, like a lot of people, they've kind of gotten to the point where they don't have a lot of hope that they can improve. And again, after talking with someone, I will tell them if I feel like we can help them or not, or where I think their problem might be coming from, if it's something that we can help them with.
Do you ever see a patient that you say, you know what, this is more than physical therapy, and you recommend they maybe take another step and maybe see a neurologist, if that's the natural progression?
Yes, I've had patients that have come in, again, had surgeries, had multiple physicians see them. We work with them, and if I don't see that they're responding appropriately, I may do some further testing. There are some outliers out there that are just not typical. And when that happens, there are several different specialists here and in Gainesville that I refer them to.
You know, you sent this this little sheet here that it's a $67 billion problem of falling.
Right.
And you see this as maybe a balance issue causing someone to fall and causing even more harm. And so they've dug themselves even deeper in a hole health-wise.
Unfortunately, the statistics bear that out. It's one of the things where no one wants to think they're ever going to fall. No one ever thinks anything's going to happen to them, but that's not what the statistics show. And actually, they show that if once a person has fallen, if they're over the age of 65 and they've fallen and they fracture a hip, let's say, the chances of them ever living independently again is about 40%.
So
it's about 40%. They'll go to a skilled nursing facility, and only 40% of those will ever live independently again.
And that's important. The older you get, you don't realize that the older you get,
Right.
the more you need your independence to survive. If you have to rely on somebody, and then good information. If you'd like more information on Fyzical and the Balance Center, I guess you're calling it the Balance Center?
Physical therapy and balance.
Yeah. You can get more information by the telephone call on the screen. If you'd like more information about the practice itself, fyzical.com/Lake City is the address, the telephone number, 755-3164. Now, Southwest Main Boulevard, you are located next to
Skip's Deli?
everybody who lives from Lake City knows where Skip's Deli is.
Yes.
Across from the old TG&Y Plaza, I like to say. That really blows people away. But anyway, Melinda, thank you for being on the program.
Thank you for having me.
Hopefully you can help more and more people avoid the costly fall and rehabilitation. And but check it out if you have some symptoms, or ask your physician to recommend Fyzical for your physical therapy. That's going to do it for now. Until next time, I'm Mike McKee. So long.